Conducting suicide risk assessments, as we will discuss here, is the role of a mental health professional. But if you are a school administrator, teacher, or other staff member, it's very crucial to understand the importance of monitoring the risk of self harm for students and knowing when to get a counselor or other mental health professional involved. So, if you are a school administrator or other staff member, this information is vital for you to be aware of so that you understand the process of risk assessments and what to be on the lookout for with your students. We wanted to create this webinar as a refresher on suicide risk assessments and how to document them. This webinar is not meant to replace your own clinical expertise, state licensure requirements, or ethical guidelines, but it should serve as a reminder on how to navigate this difficult topic that may arise in your support of students. When working with students with any history of suicidal ideation, self-injurious behavior, or mood disorders, it is crucial to complete a risk assessment as a regular part of your session, every time. Never just assume that because a client didn't mention it, it's not a problem. For teenage clients with other presenting concerns, this is also important to check in on every time. Your younger clients without a history of these concerns may not require a risk assessment every visit, but always be on the lookout for signs that one is warranted. So look for things like depressed mood, a change in mood, talking about death, loss of interest in activities, giving away items. This topic is important to feel comfortable with. Many of the students we support are coming with presenting concerns that may increase the likelihood they are experiencing suicidal ideation. For example, suicidal ideation is part of the diagnostic criteria for major depressive disorder, so we would expect to see this with some of our students experiencing this challenge. Though our focus in this training is on a suicide risk assessment, please note you should also be assessing for homicidal ideation with students. In cases where they do indicate homicidal ideation, please reach out for more support. So let's talk about some steps in a risk assessment. First off, some general guidelines. Number 1, acknowledge the student's distress. Number 2, take statements seriously and do not minimize the comments. Number 3, do not show shock. Number 4, do not agree to keep things private or to confidentiality on this topic, because you cannot ensure that. Number 5, always ensure that you know how to reach someone at the physical location of the student. And number 6, be familiar with the risk and protective factors for the student, as well as potential warning signs. We've included a handout on this topic for more information. So the first step in a suicide risk assessment is to ask. When conducting risk assessments, it is really important to ask directly about suicide, clearly asking, are you considering suicide? Or have you been thinking about killing yourself? Is very important. We do not want to just ask, are you thinking of hurting yourself? Because it's not as clear, and hurting yourself can mean a lot of different things to different people. Additionally, we want to make sure not to phrase it in such a way that we give the answer, or come off like we don't care. For example, you're not thinking of killing yourself, are you? For students with a history of self-injury, asking further questions about self-harm is important, but never skip the direct question about suicide. So, for example, if I think a student may have a history of self-harm and I'm doing a risk assessment, I will ask very clearly about both suicide and self-harm, and it'll sound something like this. Have you ever had thoughts about killing yourself? If they say yes, I'll ask for more details about when the last time they felt that way was, what was going on in their life at that moment in time, and how frequently these are happening. Next, I'll also ask specifically about self-injury. For example, have you ever hurt yourself on purpose or thought about doing so? For example, some people may cut themselves when they are feeling sad. If they say yes, again, I look for more details about methods, last occurrence, and triggering events. I also gather information about the severity of the cuts, because though some self-injury is superficial in nature, other times the amount of damage inflicted can be more emergent in nature, even if the intent is not to kill themselves. So keep in mind that many people unintentionally cause significant harm, so even if previous injuries have been minor, the issue shouldn't be minimized. So when you're asking about suicide or self-injury, if the student says no, you're able to move on to the documentation part, which we're going to discuss later in this webinar. But if a student says yes, refuses to answer, or gives a non-committal answer, you will need to do some more digging. If a student says yes and confirms suicidal ideation, you will want to gather some more information. If the ideation is passive in nature, such as, sometimes I don't want to be alive but would never do anything, or there's days I just don't want to wake up, your focus will be on building resources, coping skills, and safety planning. But if they have more active ideation, you're going to want to check for intent, a plan, including their access to means and a timeline, and future oriented behaviors and coping skills. So, intent is a crucial variable in a risk assessment and in determining next steps for a student. For example, if a student reports ideation, but also reports they have no intent to follow through, that is really important to note. To ask about this, you can say, when you have these thoughts, have you felt like you are going to act on them? Next, to check for a plan, ask them if they have thought about how they might do this or if they have a plan. For example, asking if they have ever done anything or started doing things in order to prepare to end their life. If they do not have a plan, double check if they have ever had a plan in the past. If they do have a plan, you want to get more information about what that plan looks like. So, things you want to look for include the timeline with which they plan to carry out the plan. For example, Saturday night after the parents go to bed is a much more thought out plan and timeline than the next time I get in a fight with my best friend. And then you want to look for their access to means to complete the plan. For example, do they have access to guns, pills, drugs, etc.? Some means of suicide are easier to control for. For example, we can ensure that firearms are locked up or not available. But if a student has a plan to walk in front of a moving vehicle, we would have a harder time controlling that scenario since we don't control traffic. In general, a more thought out plan means higher risk, but this is not always the case. Students that have a history of substance misuse or impulsive behaviors may not have a plan. They can be equally at risk due to the potential of impaired thinking or impulsivity. I always like to include future oriented behaviors in a risk assessment. This means I look for things that the student has coming up that they are excited about or planning for. For example, upcoming dances, sporting events, or plans with friends. You can also look for long term goals, such as planning for college or career choices. They're really great examples of some future oriented behaviors. If a student has no future plans and indicates having nothing to look forward to, this is a huge warning sign. In addition, you will always want to gather information on coping skills they can use, people they can talk to when feeling down, and then collaboratively create a plan for next steps. Students may not have these resources in place or know how to develop them, which makes for an opportunity for you, the assessor, to help them create a safety plan. Finally, if they've indicated any level of ideation, plan, or intent, you will want them to contract for safety. If they are not able to do this, further intervention will be necessary. I also like to work with them on how we're going to discuss this with the school or family to help ensure their safety. By letting the student be part of this process, you are building trust and also ensuring their buy in. Be sure to view our handout on suicide risk and protective factors for students, as well as potential warning signs. Always involve your school mental health counselor or other mental health professional to support at risk students on your campus. And please see our flyer with national suicide resources and a personalized resource plan that you can share with your students as needed. We know that your work is very challenging, so thank you for your dedication to making a positive change in your students' lives. If your school needs additional mental health supports, please reach out to us. eTherapy offers direct mental health services for students, mental health training for educators, and support for your entire school community. We're also able to help consult if you need to put some more mental health structures in place. We value you, and we are here to support you in the important work you do with students every day.